Okay, we want to take you live now to Premier Ford, taking questions or answering questions from
Charlie,
reporters.
I think
Let's
I've
listen in.
addressed this a dozen times. I went to the Integrity Commissioner, he cleared me, so next question.
You haven't addressed whether or not you told the Integrity Commissioner that people paid $150 to do that.
Again, Charlie, I've answered this 100 times.
Not this question.
And again, I think I said it publicly, so you have your answer, but next question. Thank you. We're here about skilled trades today, Charlie.
Hi, Premier.
Hi. Hi, Allison.
The appeal court struck down Bill 307, the third-party advertising rules. Why are you appealing instead of just crafting some new charter-compliant legislation like the court ordered?
Well, again, we're going to appeal it and see what happens. Personally, totally disagree, but you know that's the court's decision. That's their right. We're gonna appeal. We've talked to constitutional lawyers, and they were actually floored. A lot of lawyers were floored on that decision, but that's the process, right? So we'll go through the appeal process.
The Ontario Autism Coalition was at Queen's Park this week. They said that Minister Fullerton wouldn't meet with them. They said she hasn't really meaningfully met with them since she became minister, nor has she held a press conference to publicly talk about the program. The ministry won't release the numbers of children receiving funding under the program. Why is the minister and ministry not being more transparent?
Well, I think, number one, Dr. Fullerton has done a stellar job in her portfolio. We've increased funding to families with children with autism. When we first took office about 4.5 years ago, I think the first week they came up and told us the system was bankrupt. And that was just our first few weeks. We're pouring money into it to help families, children with autism, and we'll do anything we can to support them and give them the support that they need. It's very challenging on these families, and to be very frank, my heart breaks for them.
Hi, Premier. It's Chris Michaud from the Toronto Star.
Hi, Chris.
I wanted to ask you about the Toronto mayor's race, and
Yeah.
what do you feel about the quality of candidates so far?
Well, I don't think, we have to see everyone that's going to be going into the race, and I look forward to working with anyone. Whoever gets elected, we'll work with them. And I think a big issue is what I'm hearing out there is safety, safe communities, safe subways, safe transit. That's a big issue in Toronto right now, but you also have to be fiscally responsible. So let's see what happens. Whoever wins, I'll work with them like I do all the time.
Are you heartened to see that a former PC candidate, Mark Sanders, is putting his name out there and is a potential candidate?
Well, let's see if he's putting his name out there. Let's see if he's going to announce. I think the world of a lot of the candidates, but Chief Saunders did a great job as police chief, and if he goes in, that's good. I think that's great. A good field of candidates is always healthy for the people to decide on, and let's see what happens.
Hi, Premier. It's Cynthia Mulligan from City News.
Hi, Cynthia. I haven't seen you in a while. Good to see you.
It has been a while.
Yeah.
My first question is for my colleague Nick Westall, who has been doing a lot of work on the Eglinton Crosstown, even had FOIs.
Yeah.
There is no transparency from your government as to what the heck is going on with the Eglinton Crosstown. It's way behind schedule. There's no date as to when it will be completed, and there's no explanation as to what the problem is. And Nick's FOI found that people in Caroline Mulrooney's office wanted to give more explanation, but that was quashed. So why is there no transparency, and what is the problem with the Eglinton Crosstown? Well,
first of all, thanks for that question, Cynthia. And as you know, we inherited quite a mess on the Eglinton Crosstown, but we've had time to move forward and get it fixed. And we're working with Metrolinx, we're working with Phil Verster and the Ministry of Transportation. But I'll give you the good news on Eglinton. So the new line, Eglinton West, that's heading out close to the airport. They're actually 4 weeks ahead of schedule. They're on time, on budget. We're building the largest transit system in North America, no matter if it's a Young Extension or the Scarborough line or the Great Ontario line in the Eglinton West. But we're on to that. We want to get that Eglinton Crosstown open as quickly as possible. You know, Cynthia, I remember we were negotiating when Rob was mayor. That's how long ago that was. And you know, sure, they've had a bump in the road, but we're doing great work right across the city, building largest project in North America right now. But I hear you. I'm not dismissing that, Cynthia, at all. I want it open just as quickly as everyone else.
Okay, I want to switch to the FAO report that was released at 9 o'clock this morning.
Yep.
It's a fairly concerning report because it's suggesting even though you have pledged, and I know you have pledged billions more in healthcare spending on infrastructure, that it's not going to be enough, that you're going to be $21 billion short. And I will give you that I know that this is a problem that's been building for decades.
Yep.
But it is concluding that you're $21 billion short and you're still going to be with less capacity than will be required. What do you say?
Yeah, well, thanks so much for that, Cynthia. And I'll answer, then I'll pass over to my finance minister. The FAO, you know, they only take a snapshot in time, and I guess it's really frustrating to ourselves and the finance minister. They don't include the health transfers, and they aren't including any additional money that's going forward. But I'll tell you what we are doing. Since we've taken office, while the FAO report said in 14 years under the Liberal government, they created 830 beds. In 3 years, we've created 3,500 beds. We're adding an additional 3,000 beds. We're putting on the infrastructure side, as you were saying, we're putting 50 new additions or new hospitals across the province. We've hired 60 or registered 60,000 new nurses since 2018. Those are pretty staggering numbers. We're hiring 8,000 new doctors. Last year alone, the College of Nurses put this out. It was a record in Ontario, bringing on 12,000 more nurses. And the great thing is we have 30,000 nurses in our colleges and universities. We've really made some real great announcements over the last few weeks about the prescriptions. Rather than, you need a prescription filled, rather than waiting 3 or 4 days to get the doctor and get a prescription, we've seen 100,000 people go into the pharmacies and fill their prescriptions. The Learn and Stay program to get more nurses that we're paying for their tuition if you work in a rural area. And there's just so many other areas, but this is the reason, Cynthia, and thank you for mentioning this. This is the reason I've been shouting at the top of the hill about we need the federal government to step up, and we signed the deal, and it's a great down payment, but it's not sustainable. As we're spending, folks, $75 billion. There's another increase coming in healthcare. We've increased it by $14 billion. We're pouring money into the healthcare system. We gave the nurses a $5,000 bonus last year. We gave the PSWs a $3 increase. So we're throwing everything in the kitchen sink at healthcare. But this is the reason we need to do things differently. This is the reason we got to get caught up on the backlog surgeries. This is the reason that we need community surgical clinics to knock down the 203,000. Just imagine people with cataracts waiting for a year or 2 years until they get proper vision. Imagine someone, your loved one, needs a hip replacement. They're waiting a year and a half for a hip replacement or a knee replacement. Our goal is, as we get everything moving forward in the years to come, to deliver knees, hips, cataracts, one of the quickest in the country. That's our goal, but I'll pass it over to the finance minister. Thanks for that question.
Well, thank you, Premier. Boy, that's good. Wait, you're doing some incredible work there. I just wish I had my notepad. Look, the FAO's job is to speculate about the future, and as the Premier says, just take a look at the evidence. Just take a look at what we're doing. unprecedented historic increases in healthcare to pay for everything that the Premier just said, because we did inherit a couple of decades of, as Cynthia mentioned, an infrastructure and a people deficit in our healthcare system. You know, my job is to actually make sure we fund those priorities. We've seen the healthcare budget go up by over $5 billion last year. We're going to continue. We're going to continue. So, you know, the FAO's job is to speculate on the future and maybe about where those contingencies go. I wouldn't be doing my job as finance minister if I didn't have contingencies.